India is taking action to combat airborne transmission of COVID-19. It's calling for better ventilation at hospitals and vaccination centres. For a fourth straight day, new cases have dipped below 300,000. Live to Ishan Garg in a moment, but first, a look at whether the numbers are telling the whole story.
Official COVID-19 cases in India may have dropped in the last week, but it's still difficult to judge the true scale of the pandemic. Many cases are likely going unreported due to a lack of testing, especially in rural areas of the country. But new data has now provided some idea of the level of infection. A chain of private laboratories has revealed that nearly 2/3 of people tested in the last week have coronavirus antibodies in their blood. At the same time, new guidance has been introduced to help stop the spread of the virus. Ventilation is now a major focus, as scientists increasingly accept that COVID-19 is airborne. The government has warned that aerosols carrying the virus can travel up to 10 metres. They're encouraging people to keep windows and doors open and to change the position of any fans that may be blowing contaminated air directly towards other people.
Ishan Garg is live for us in New Delhi. Ishan, Prime Minister Modi has held a meeting with officials from 10 states. What's the latest on his COVID response plan?
Well, the first thing that the Prime Minister has really harped upon is active and more efficient data management, especially in smaller towns and villages, so that the government can have enough data to respond to the pandemic better. The second thing that he asked is to keep an eye on infections occurring in youngsters and children, because there are concerns that a sublineage of the India variant, the B1617, could cause severe diseases in children. But the bigger policy shift that we are seeing from this government is now that instead of taking a top-down approach where the federal government would instruct districts and towns to take some steps, it's now taking a bottom-up approach, which means that it's essentially asking these administrators in smaller towns and villages for advice to tell the federal government what the government should do. So there is a huge emphasis now on involving community, in involving leaders at the village level to spread the message about COVID-19 and to give people the correct information about COVID-19 and the vaccines as well. At the same time, there's also a massive push to reduce vaccine wastage. Prime Minister has said that even one vaccine, if it goes wasted, that means that one life could not be saved. In some states, the vaccine wastage is almost as high as 12%. And all of these factors combined are really going to make the policy move for the next steps that the government should take to battle the pandemic.
Meantime, Ishan, the government's also rushing to curb the spread of black fungus infection. That's been affecting COVID-19 patients.
Absolutely. It's proving to be one of the biggest worries in the recent times. So one of the biggest hospitals here in New Delhi, the All India Institute of Medical Sciences, one of the prominent hospitals in the country, is reporting close to 20 cases every single day. And the figures from different hospitals in Delhi itself are quite similar. Now, I've been speaking to different doctors, and some of them say that this could be rooted in a massive diabetes problem in the country, especially in men between the ages of 40 and above. And also in some of the younger patients as well. And of course, there's also been, the government has also pointed this out, that there's been a sort of an abusive use of steroids as well for treating COVID-19 patients. And that's leading to issues around black fungus. But of course, government is saying that there is more data that needs to be studied. And at the same time, they're not saying that it's a cause of concern to the level that people should start panic. But it's something that doctors certainly need to keep in mind, because the disease can be fatal. And if it's not, it can certainly involve a lot of medical resources, because of the nature of the disease can sometimes involve doctors specializing in different parts of the body. So that will take in a lot of resources, and at the same time could prove to be very detrimental for the health of the people who've got it.
Ishan, thank you very much. Ishan Garg there in New Delhi.